Well, we are really very fortunate to have you with us because you bring us like new hope and new direction. Can you reiterate for us some of the new things that you're bringing to the clinic?
Sure. Well, most people are familiar with some of the standard treatments that we have here, which was Dr. Burton's IAT, immune augmentation therapy, some of the vaccines like heat shock vaccine, tumor-specific vaccine, dendritic cell vaccine. We also do Coley's toxin vaccine, and we're also offering something new to certain patients, which is Dr. Hal Gunn's SSIS vaccines. This is just a newer version of the Coley's vaccine that's more organ specific, with a little less side effects in terms of strong immune reactions that you would normally get with the Coley's vaccine. So we have all of those things, plus we have some of the nutritional support. Like you mentioned, the vitamin C IV is sort of a grounding, along with the other nutritionals that's in the vitamin C IV, and some of the homeopathics that might be in there too. There's also various different programs for supplements. So usually the patients will meet with me to formulate a nutritional supplement program. And that's individualized depending on the type of cancer that they have, as well as other problems that they have, because there's no rule that says people who have cancer, that's the only disease they have. They may have other issues. They may have heart disease, hypertension, eczema, psoriasis, arthritis. You know, they could have all kinds of other things. And so, of course, we want to address those things too, because anything that's stressing the immune system or stressing the body is going to stress the immune system. It's going to, pull attention away. So intestinal dysbiosis is important. One of the things I tell most of the patients is the famous physician Paracelsus said, death begins in the gut. So the correlate of that is healing begins in the gut. If you don't have a healthy intestine, any supplements or food that you're taking is not going to be properly digested and absorbed to even get to where it's supposed to have the proper benefit that it's supposed to. So you have to have a healthy gut. And what we find is that after chemo and the antibiotics and all the rest that usually goes along with it, and the steroids and everything, people come in with just terrible gut function. And we need to restore that in order to build on that so that we can then, they can get the benefits from the supplements that they're taking. Because they may be taking supplements, but there's no guarantee if they have a poor gut function, poor intestinal function, that they're not getting the benefit. So their intentions are right, but they just may not be getting it. So we can do functional assessments like spectral cell analysis to actually see if, even though they're taking these supplements, is their body function actually, functional requirement actually being met. So there's a whole bunch of tools that are available to us to help assess, the